Amalraj. He's a child health consultant. He did his MBBS in Madras Medical College, MD Pediatrics in Madras Medical College. He was an EB member of IAP in 2014 and 2015, Treasurer IAP in 2016 and 2017. He is an EB member in Adolescent Health Academy, IAP Chennai, 2018 and 19. Currently, Academic Affairs Administrator and EB member in IAP TNSC 2020. Very active academician. Sir is here to talk about Clinical Establishment Act, need of the hour, and this message has to reach even the smallest clinic in the smallest district of Tamil Nadu. Thank you very much, sir. Over to you.
Amalraj, are you there?
Yes, sir. I'm very much there, sir. Am I audible, sir?
Yeah. Can you raise your voice?
Yes, sir. Am I audible, sir?
A bit more. I think slightly. You are audible, but yes, not clear.
Am I audible, sir?
Now it is good.
Yes, sir. Yes, sir. First of all, I would like to thank Dr. Sudarshana for those kind words. I would like to thank, good evening, my dear friends. It is a wonderful opportunity to talk with the elite panel of speakers, actually. I would like to thank our Tamil Nadu State Chapter President, Dr. Sendil sir, our Secretary, Dr. Suresh Balan sir, our Treasurer, Dr. Rajendran sir, for giving me this opportunity. It's a pleasure working with this wonderful team for the past 1 year. I thank God for giving me this wonderful opportunity. I would thank Sunil sir, who has been the brain force behind this smart clinic project, and also Dr. Muthukumar sir. And at the outset, I would declare that the entire slide, the original architect of all these slides was Dr. Sudarshana. I have just made a few modifications. Fine, my friends. So it has been a super smart Sunday, actually, because there are a lot of smart phases in today's Zoom program. And also there was a talk, there was a talk more exhaustive about the smart gadgets, smart books, smart digitization, smart communication, smart investment, and then smart counseling. At the end of it, we are now pushed to a different situation where we have the legal frame, which is embracing our medical frame. So what is this Clinical Establishment Act actually? So whatever we are doing, whatever setup we have created, we are bound by the various government rules and regulations. So what are the government rules and regulations? If we look at the Tamil Nadu government gazette, the Clinical Establishment Act is actually not new. The earlier act was actually proposed in the year 1997 itself. The one which has been done is just an amendment, and it is actually the term which we use is the private clinical establishment. That's the only term which has been newly coined. Otherwise, it's the same thing. It has been in vogue in our state from the year 2018. Fine. So what is the CAA? What is the need for the CAA? The Clinical Establishments Registration and Regulation Act. It was enacted by the central government in the year 2010. Fine. This is to provide for registration and regulation of all clinical establishments across our country and to prescribe the minimum standards of facility and services to be provided to the community. So why this act? This act has been mainly proposed to establish a digital registry of the clinical establishments at the national, state, and district level. One of the main purposes is to prevent quackery by introducing mandatory registration system, to improve the quality of healthcare by prescribing the minimum standards of facility and services for healthcare, and ensuring compliance of other conditions of registration like compliance, standard treatment guidelines, stabilization of emergency medical conditions, display of rates to be charged, maintenance of records, etc., etc. Fine. This slide is actually a summary of the health regulations across the various states and union territories of our country. This is as per March 2017. After this, many changes have taken place. If we look, there are 5 groups of states in our country. One is Group 1, the states in which the CAA 2010, which was initially proposed by the central government, that is our Indian government, has become applicable from the date of notification. This was from the 1st of March 2012. The states which have been following this are the states of Himachal Pradesh, Mizoram, Arunachal Pradesh, Sikkim, and a few other states. Next comes a few states which have adopted this CAA 2010, but they have their own legislation in their state assemblies. These include the states of Assam, Bihar, Jharkhand, Uttar Pradesh, Uttarakhand, and Rajasthan. Next, we have a Group 3 states which have their own act, like West Bengal, Maharashtra, Andhra Pradesh, Orissa, Delhi, Manipur, Nagaland, Madhya Pradesh, and Punjab. And next we have the Group 4 states, which include our own state, that is Chhattisgarh, Haryana, Jammu and Kashmir, Meghalaya, Tamil Nadu, and Tripura, which have implemented the act from, and it has been in work from 2018. The remaining states which have not adapted so far as on 2017 are the states of Gujarat, Kerala, and Goa. So this is how it's not the same throughout our country. There are state to state variation that we should understand, because some of us may be practicing here and we may shift our practice station to another state also. So we have to be very clear about the rules and regulations which are governing that particular state. So the most important question which every clinician will have to question himself is, does my clinic have to be registered? Yes, it has to be registered. The act is applicable to all types, whether it's therapeutic, diagnostic type of clinical establishments, whether it's a private or public sector, applies to all systems of medicine. Even if it's a single doctor clinic, we have to register. The only exception is the clinical establishments which are run by the armed forces. So the bottom line statement is, no one can run a clinical establishment without a registration. Fine. So every existing clinical establishment has to apply for registration. Within 1 year, we start our practice. See, the purpose of this talk is mainly to address to people who have their own clinics and they have their own consultation chamber, because hospitals would have to know the rules and regulations prior itself. And every new clinical establishment which has come into existence after the commencement of the act, that is from 2018 November, they have to apply within 6 months of their establishment of their clinic. And the certificate of permanent registration is granted for a period of 5 years, after which you have to renew. You are given a grace period of 6 months, but in our state, you are given a grace period of only 3 months, that is 90 days. So this is how, it's actually a very simple procedure. If you go through the website, that is the Directorate of Medical and Rural Health Services, you have to create your own profile, and it is very easy to complete this entire process. It goes like this. You have to go in for a new registration, then you have to log in, you get an activation code, and also you go ahead. It is hardly a half an hour process. The entire amount, the total cost which you spend is rupees 5,000, which you have to pay either as through your online payment at the end of it. So who will implement this Clinical Establishment Act? It is the state government. It is the state subject actually, okay? And each states have their own rule, and the governing bodies are arranged in such a way that you have a state level state council for clinical establishment, which governs and looks over the entire process. You have a chairman health secretary, then you have a member secretary, and also you have the various representatives in the line of the paramedical system, and also the state level consumer groups also. There's an entire team which is going to be involved in this entire process. This is a notification which was issued in the vernaculars actually during the end of 2018 actually, regarding the registration, how long you have been given the time frame. They have clearly mentioned the last date for registration as 2019. Now, after that, all the clinical establishments will be considered illegal, and they are liable for penalties as per the CAA Act. So, regarding the registering authority, they may authorize an inspection or an inquiry to be conducted on the registered clinical establishment by a multi-member inspection team. A show cause notice may be issued if the authority feels that a clinical establishment is not complying with the conditions which they have proposed. It may even prompt them to do a cancellation of the registration. And the authority may enter and search in the prescribed manner after giving notice of its intention to the clinical establishment if it suspects that an establishment is operating without a proper registration. So what are the things which we have to know? There are different types of the definition varies for the pattern which is being followed for different setups. For example, a single doctor clinic, then you got a clinical laboratory, a consulting room, a hospital, and then a polyclinic. So the application of registration, I've already told you. First of all, you have to enter into the website, that is your clinicalestablishments.government.in. Then you have to go for the name of the establishment, what type, that is whether it's a clinic or a consulting room or a polyclinic or a multidisciplinary center, whatever it is. Then the address has to be mentioned properly. The month and year of starting of practice has to be mentioned. The location, the ownership, whether it's a public or private sector, whether it's registered, whether it gets governed under the Society or Trust Act, the name, designation, the qualification, and everything matters, and also the system of medicine which is being followed. So this is what I told you. The type of establishment, whether it's a clinic, it's a single practitioner clinic or a polyclinic or a dispensary, daycare, hospital, nursing, whatever it may be. And the allied health professions, the type of service, it's going to be a GP or a single specialty or multi-specialty. The infrastructure details like your area of establishment, the total number of OPDs, everything there. If you go through when you register your clinic, you will see there are so many columns to be answered before you submit it. So if for a consulting room or for a clinic, these are the things which are very, very important. Actually, Dr. Paniraman sir actually clearly mentioned about in his talk about the smart gadgets which are needed for a smart clinic. This includes a good examination couch, a BP apparatus, sphygmomanometer, and very importantly, we are not supposed to use a mercury containing apparatus at all. That is very, very important. It is all which will be rejected once they come for inspection. Some of the doctors have faced it. A good stethoscope, torchlight, tongue depressor, thermometer, also the same thing as Dr. Paniraman sir mentioned. We are not supposed to use a mercury thermometer, that's banned. And weighing machine for adult and pediatric, because we may see even adolescents also. A good knee hammer to do a neurological examination, measuring tape. And based on the needs, you may even need examination trays like proctoscopy, pelvic examination tray, eye testing screening, your Snellen's chart, and also beside you should have a sufficient privacy for examination the patient. And you're supposed to, those who are giving vaccinations or injecting, you need to have a proper sterilizer and autoclave arrangements for getting autoclaved all the used syringes, or also or a proper biomedical wastage methodology to throw those things, and also the sterile gloves, proper forceps, scissors, surgical equipment, other surgical equipments, suturing trays in need of emergency, kidney trays, and all the basic emergency medications, surgical equipments for abscess drainage and incision. So what about the consulting room? The consulting room should be of a space of not less than 100 square feet with sufficient lighting and ventilation. You should have a separate space for patients waiting for consultation. And also the staff, the examination of patient, prescription of the treatment shall be done by a registered medical practitioner only, which has been prescribed under our Indian Medical Council Act. In addition to the norms prescribed for a consulting room, the building, you should also have sufficient space for 2 cots, and for proper examination. You should have all the emergency drugs to handle any anaphylaxis or any medical emergency. You should have a minimum a doctor, a paramedical staff with you. And you also have to maintain a proper register with all the details of the patient, the age, sex, and address of the patient, date of examination, especially this COVID season, where we may need to get, we have to track the patients also, especially in the COVID times. The patient shall be given a slip containing the name, age, sex, and date and consultation, the diagnosis which have been provided, at least a provisional diagnosis. Then the prescription slip, the doctor shall sign the proper signature with the date and seal. So if you are running a pharmacy or a lab, if the clinic is also established dispensing of medicines to the patient, the same should be done by a qualified pharmacist, or the doctor can do under his direct supervision. If he is having a separate laboratory in his own clinic, the laboratory work shall be done by a qualified technician, or alternatively, a medical officer can also get the test done under his direct supervision. That is very, very important. So this is very, very important. Biomedical wastage management is very important because we have to do proper disposal of all the waste items, the method of treatment, the disposal of biomedical waste, because these things have, this is a very important requisite before we go in for an application for a clinical establishment. And also, you need to have that agreement with you always. This agreement is being done for a period of 1 year, which has to be renewed subsequently. And you also need to have a one-time authorization from a pollution control board depending upon your location. That is very, very important. So these things are very, very important. Apart from that, you're also supposed to have a fire extinguisher also. That is also very, very important. The fire extinguisher, you should have one fire extinguisher for each room. That is very, very important. So following this, then you get the inspecting team which is going to visit your clinic, and then you get the certificate of registration. The competent authority shall, after holding an inquiry, after satisfying itself that the applicant has compiled with all the requirements of the Act, and then they grant the private clinical establishment a certificate of registration. But if after inquiry and after giving an opportunity to the applicant of being heard, the competent authority feels is satisfied the applicant is not complied with the requirements of the rules and regulations, then they can reject the application also. So this is what I told you. Every certificate of registration is valid for a period of 5 years. It should be renewed subsequently every 5 years. And every application or renewal of registration shall be done within such a time as may be prescribed, and the provisions of the Act shall as far as may be apply in relation to the renewal of registration, or as they apply in relation to the registration. If a certificate of registration lost, destroyed, mutilated, or damaged, for example, if there is any flood or something like that, or any fire accident, the competent authority may, on application and on payment fee, they can issue a duplicate certification. So this is with regard to inspection. Inspecting team can inspect or private establishment anytime. They have the, and anytime, even if we get the proper registration certificate, it doesn't mean we can be free for the next 5 years. It's not like that. They have every right to enter our premises, and we have to ensure that we have to keep everything intact. In fact, we also have to keep our medical registry or medical registration certificate or post graduation certificates or all the degree certificates which has to be displayed outside our clinic premises. So these are the other things which I told you. Those who have, it's better to have a rental agreement, but not all competent authorities, they don't ask for this. For example, for me, they did not ask these things, but it may vary from place to place. The building stability certificate may be needed in some cases. Fire extinguishers very must. It's not one for the entire clinic. It should be one for each room actually. And for especially for pediatric practitioners, we need to have our proper cold chain temperature recorded to be maintained uniquely. That should be that record should be kept for the past 10 days. And at the display of a clinic, you have to keep a copy of the certificate of registration, and also you should exhibit the relevant provisions of the Prevention of Violence and Damage or Loss to Property Act. This is very, very important. This is one which I have displayed in my.
One more minute.
Thanks, ma'am. I'm going to finish. So this is at the end of it, you're going to get this wonderful certificate for which you toiled hard for such a long time. And this is the situation which Tamil Nadu faced during the early part when the Registration Act came into vogue actually. Nearly 20,000 clinical establishments faced the prospect of a closure due to not following the rules and regulations. And it can even, if we don't follow rules and regulations, we may end up even in suspension or cancellation of registration also. The competent authority may sue motu or on a complaint issue notice to any private clinical establishment to show cause why its registration under this act should not be suspended or cancelled for the reasons mentioned in the notice. And it may take even action against the private clinical establishment, suspend its registration for such a period as it may think fit, or cancel its registration, provided that where the competent authority is of the opinion that it is necessary or to do in the public interest, it may even have reasons to be recorded in writing, suspend the registration of any private clinical establishment without issuing due notice. So all these things matter.
Question time.
So these are the penalties which are faced. Just 2 more slides, ma'am. These are the penalties which you may face. Running a clinic without SAB can't be imprisoned. That is one thing which we should always keep it in our mind. But of course, we may have a lot of monetary punishments. Like if we run a clinic without a registration, we may have an offense punishment of 50,000 rupees during the first offense. Then it goes to 2 lakhs. Then it becomes 5 lakhs. And as Dr. Tirumadi Kalandar sir told you, all the hard-earned investments have all gone through this. So these are the other penalties which we may face. So thank you, and this is the wonderful slide which I want to present at the end. This is a smart young cricketer. He is none other than Natarajan, who hails from a small village town called Chinnapampatti in Salem district. He is a smart cricketer. Why I call him a smart cricketer is because, and from a very tough family background, he has emerged playing in our country. He's now one of the top bowlers of our country, and I deem it a good occasion to display his picture to show, because it's a smart day, it's a smart clinic day, and he's also a smart cricketer. Thanks, my dear.